Namaste and welcome to CIWEC Hospital. Today we'll be discussing in this video about altitude illness. I'm sure you've heard of it. We know that you're planning a trip to the Himalayas for trekking, so this might come in handy for you. Altitude illness, or acute mountain sickness as it's commonly known, commonly happens in places of high altitude, more than 10,000 feet or 2,500 meters in altitude. It happens because your body fails to adapt to an environment of low oxygen, which it is not used to. The body usually reacts by increasing your heart rate or your heartbeat, your breathing, and making you pee more. If within a certain amount of time your body cannot adapt to this new setting of low oxygen, that's when you get symptoms of altitude illness. While altitude illness is common, the good thing is that it is preventable and manageable. The problem that most people face is they fail to recognize the early symptoms of altitude illness and then get into trouble by continuing to ascend higher. So, talking about the symptoms of altitude illness, the most common and the most important symptom is headache. The headache can be of any kind, the front of your head, the back of your head, all over the head, and it can come as a throbbing, pricking, or even an ice pick headache. So if you have headache, and together with that, if you have any GI symptoms, gastrointestinal symptoms like nausea, lack of appetite, and vomiting, those could be symptoms of altitude illness. Along with that, there is extreme tiredness or fatigue that is unusual for the amount of activity that you are doing at the moment, and that does not resolve by taking small breaks or rest. The other thing to keep in mind would be dizziness. So if you feel very dizzy and if you have a headache, that could mean altitude illness. Of course, you might be thinking that all of these symptoms sound so familiar as they can be caused also by dehydration and by other things that happen besides altitude illness. However, if you are drinking a substantial amount of fluids, if everything else is okay, and if you still have the symptoms and you are at high altitude, that might be altitude illness. What do you do when these symptoms appear? Again, the first thing is you stop ascending higher. You stay at that place wherever these symptoms have appeared. You can take symptomatic management, so you can try something for the headache, you can try something for nausea. You will need to increase your fluid intake just to make sure this is not dehydration. And if the symptoms persist, the easy thing about altitude illness is you can just descend at least 300 meters or to a point where you had absolutely no symptoms. And that should take care of altitude illness. Besides acute mountain sickness, there are two other forms, more dangerous forms of high altitude illness that you might encounter or you might have heard of. They're commonly known as HAPE and HACE. HAPE stands for high altitude pulmonary edema, so it has got to do with your lungs. And HACE is high altitude cerebral edema, the brain. In case of high altitude cerebral edema or HACE, it happens when the symptoms of your acute mountain sickness that we talked about get worse. You keep on ascending, your body's still not adapting, and your skull starts filling with fluid. That's when symptoms of headache worsen, you will have vomiting, and you might have disorientation, drowsiness, and lack of balance, which is a key feature of cerebral edema. So when you're walking on a trek, you suddenly start feeling, or more usually, it's your colleagues or your guide who notices that you are not walking straight, you are fumbling. And that might be a sign that it's gone very serious, and it might be high altitude cerebral edema. Similarly, with high altitude pulmonary edema, it's your lungs. So the first thing that you notice is you're getting more tired and more short of breath than what you are used to for the same level of activity. And the shortness of breath does not improve when you rest. You might have a very high heart rate. You usually have cough to a point when it gets bad, you might be bringing up pink and frothy phlegm, and you can also have fever. But to note, you'll be very short of breath, your capacity to exercise or trek decreases dramatically, and you can have cough. And your oxygen saturation drops. So all of these features will suggest high altitude pulmonary edema. High altitude cerebral and high altitude pulmonary edema are considered as emergencies at high altitude, and you need to descend to a lower altitude, preferably to a place where medical care is available. There are medications and other things you can do to help, including if the oxygen is available for any form of altitude illness, that will be a stopgap measure until you descend to a lower altitude. So this is about altitude illness, and we will now talk about how do you prevent altitude illness. So the number one thing you do to prevent altitude illness is give your body time to acclimatize. So when we say that, you have to maintain an ascent profile, a recommended or approved ascent profile, which would be 300 to 500 meters in 24 hours when you ascend above 3,000 meters. So you will see on the treks, many itineraries are designed with an extra night rest beyond 3,000 meters at almost every 1,000 meters of ascent. And that is by design. So that is meant for your body to acclimatize, to get used to this new surrounding of low oxygen, and help your body get used to it so you do not get altitude illness. So that's what you need to do. And therefore, it is very important to have a flexible itinerary when you plan your treks. Number two, hydrate well. This is just because you will need to rule out dehydration for altitude illness. So if you are hydrated well, we know it's not dehydration and it can be altitude illness. Number three, if you have any ongoing medical conditions, make sure that they are optimized before you head on to the trek. So these are some things you can do to prevent high altitude illness. Remember, you can come to CIWEC for a pre-trek consult about all of this and anything else that you would be interested in.